It is a little bit of a thing being a family doc and geriatrician in the epicenter. I'm in Bed-Stuy, Brooklyn, New York, and practice both with individual patients as well as do national and global strategy. So I want to back up a little bit to the data because I think, if we look at the role of power, politics, and culture as to why that data wasn't there in the first place, that's a really, I think it's a really significant kind of overarching theme in terms of all of our work because you can look and see that there was an actual push around mid-March by a bunch of Black doctors and professionals to call for the data because we had heard from the ground between clinicians that were working in communities, especially here in New York and all around the country, that there were more Black folks dying than what was being reported. And we started looking at public health departments around the country and seeing that data wasn't being reported. And after we listened to and talked to many individuals, we found out that there were two reasons. It was not being reported for fear of being seen as not serving communities or being racist. And it also wasn't being reported because folks were fearful that once the data came out, that maybe there would be a militarization like you're seeing now in New York. So I want to just point to that like this data, this truth, this hard truth of the country that operational and institutional racism is in the fabric of everything and threads through everything we do and is powerful and will kind of stop us from progressing if we don't push back on it with our power, privilege, and access is a key thing. Moving from data to action requires that we have data and use all of the things we know. So like, how do we act now, with the data that we have, and continue to push with the power and privilege and access that we have to address the repercussions of starting late.